Hey, so I don't really have much to update you all on. Today is cycle day 12. Um, I'm not doing an IUI this cycle, and my and I haven't ovulated yet. But when my cycle did come on, so I did the blood test on last Monday, and it was negative, of course. But so when I talked to or the doctor called me, I missed her phone call. She left a message and was like, oh, when your cycle comes on day 1, I guess they were thinking like, oh, since I was taking progesterone, it wouldn't come on, but it did come on schedule, even with the progesterone. So she was saying on the voice message that, oh, your cycle will come on within the next 1 to 2 weeks. And then when it does call us, it'll be day 1. I'm like, oh, I'm already on day 4. Like, but yeah, it was a normal cycle. But when I got the voice message, I emailed the nurse back, and I told her, and I was saying, I was gonna come in next month since it was already day 4, and that I wanted to take the follistim myself without because I had leftover follistim from the last IUI, because they only gave me, I was only taking 37.5 IU, or yeah, IU, is that what it's called? Yeah. And she said that was the lowest dose that they could give you. And in my mind, I was like, why am I taking such a low dose? And then I only got 1 follicle. But anyway, so this cycle, I wanted to do the follistim on my own. So, and I talked to my husband about it. He was like, and I googled it. I googled it before, and then everybody was saying, oh no, don't do it, because you can have an ectopic pregnancy, you can have, run the risk of having multiples and all of that. And so I talked to my husband about it. He's like, the only way he would feel comfortable with me doing that is if I actually talked to the nurse or the doctor about it. So I emailed the nurse, and I asked her, like, can I take the follistim unmonitored this cycle? And of course, she said no, capital letters. And she was it basically said the same reasons that I just said just now. And she said, even though the box says, use within 28 days of opening or whatever, you know how, like, it's kind of like milk. You can use it a little past the date. But she said that we can use it the next cycle. But I talked to her and see if I just need to order some more. I'll probably just order some more. But then I'm also ask about why I'm taking such a low dose. I just feel like, so I got a phone call just now. But yeah, so I have an appointment. Well, so I talked to my RE. She said no, don't do it. So I'm not gonna do it. I'm probably gonna order new medicine the next cycle. And let's see. Yeah, so that was kind of disappointing. And I was like, yeah, So my husband was like, yeah, make sure you call and get approval before you do this, because, you don't want to mess nothing up that ain't really broken. And some people have lost like a tube, and all kind of stuff can happen without it being monitored, taking follistim your own. So, but right now I am about to wrap up this video because I have to go to an appointment to get my referral extended. So I started this YouTube journey. Now, my journey has been long, but I started this YouTube journey probably about a year ago, over a year ago. So it's been over a year of me documenting my journey. But for my referral, meaning I had to get a referral in order to go to the fertility clinic. And so my referral expires in April, the beginning of April. And I need to extend it, or try to extend it. And so I don't know if my doctor, my primary care provider, will extend my referral, only due to the fact that the referral is for diagnostic testing only. And so, but the fertility clinic kind of wraps up the other stuff in it too. So like that's how sometimes like some of the ultrasounds and stuff are free. So I and some of the other stuff are free, but like the actual IUI procedures, you have to pay for that out of pocket because the Army don't cover it. So I have actually done all of my diagnostic testing. I've done every test that they could run, but my reasoning, I still want the referral extended, so that way I can still have some of the ultrasounds covered, or I'll have to find, I don't know, there's another plan that I could use. I'll have to talk to TRICARE that I could use to cover the ultrasounds and the other stuff outside of having a referral. But hopefully, she says it's okay. But I've heard that it's really, really hard for some people to get referrals and stuff. And I got mine fairly easy because I had already had one before, and I didn't really get to finish my full testing last time. But this time I got to finish everything. So, but I'll talk to y'all later, and continue to pray for me, and I'll continue to pray for you all. Thanks for watching. Bye.